Hi, I am Dr. Ranjit, Senior Lecturer, Department of Periodontics, SRM Dental College, Ramapuram. Today my topic will be on PSR. PSR is nothing but Periodontal Screening and Recording System. So PSR was given by American Academy of Periodontology along with American Dental Association. This PSR was used for general practitioners to it was designed for easier and faster screening and recording the periodontal status of general practitioners. So how do we go about doing PSR? So you divide the oral cavity into 6 sections: upper, right and left posteriors and upper anteriors, lower right and left posteriors and the lower anteriors. So this is how we divide the oral cavity into 6 sections. So when we divide the oral cavity into 6 sections, next we go about screening with the CPI-TN probe. CPI-TN probe is nothing but community periodontal index for treatment beads. Now the probe, it has a ball tip of 0.5 mm and there are 2 color codings in the probe: 3.5 to 5.5, 8.5 to 11.5. Now for PSR, 3.5 to 5.5 is the base. So with that base, we start probing on all the 6 surfaces of the tooth. It is mesiobuccal, midbuccal, distobuccal, mesiolingual, midlingual, and distolingual. For the upper, it's on the parietal surface. So once we probe on all these 6 surfaces, PSR, there are 4 codes. So it goes like code 0 is nothing but the color band of the probe, 3.5 to 5.5 mm, should be fully visible. 1, there are no supra and subgingival deposits and no bleeding on probing. Overall, the patient has an healthy gingiva. That is code 0. Next is code 1. In this patient, if it's code 0, we have to just give oral hygiene instructions. Next is code 1. Code 1, again the color band is fully visible. And then there is no supra and subgingival deposits, but there is mild bleeding on probing. In such patients, require supra and subgingival scaling along with oral hygiene instructions. Next is code 2. Code 2, again the color band is fully visible. And there are supra and subgingival deposits along with defective margins are present. And there is bleeding on probing, and the patient requires supra and subgingival scaling and oral hygiene instructions. Next is code 3. In code 3, the color band is partially submerged. In this scenario, the 3.5 to 5.5 mm color band gets partially submerged. So the significance is that there is a pocket persisting in that site. So if there is a partially submerged band, then we have to do a periodontal examination and charting of the affected sextant. If there are more than two sextants with code 3, the entire mouth should be should go for coding with comprehensive full mouth examination and charting. The last one is code 4. In code 4, we have the color band 3.5 to 5.5 mm fully submerged, which shows that there is a probing pocket depth of more than 5.5 mm. In such scenario, there should be comprehensive full mouth examination and charting. The treatment plan is needed. After the code 4, we have a code called asterisk. So in asterisk, where do we place asterisk? So if there is furcation involvement, if there is mobility, mucogingival problem, and gingival recession, which is greater than the color band of 3.5 mm and more. In these scenarios, you go for code 4, code asterisk. So along with the code, if there are any findings, then we go in for asterisks. So the take-home message is that after doing the PSR, any section of code 3, 4 or asterisk, it is better for the practitioner to take a periodontist opinion for treatment plan and periodontal therapy for betterment of the patient. Thank you.